diastasis. So the rectus abdominus muscle, or your six-pack, attaches up to the top of the sternum and then goes all the way down to your pubic bone. And during pregnancy, which is typically when people have a DRA, obviously the biggest change that we have is our bellies expand. And as that happens, the tension increases on a little piece of connective tissue called our linea alba. So that's a piece of fascia that connects all the way down and helps to keep the two pieces of the rectus abdominis together. So as we stretch, there's more tension on the linea alba and it begins to separate, and that fascia actually thins a little bit. So we can have a couple different kinds of diastasis. One that's open right at the belly button, one that opens below the belly button, above the belly button, or sometimes it actually stretches all the way down. So the distance between the two muscles on either side is called the interrecti distance. So that's what we're looking at when we're assessing a diastasis. And what's considered pathological, or something that we would want to actually treat, is typically about 2 finger widths apart, or about 4.5 centimeters. So that's what most of the literature when we're looking at treating diastasis is going by. So this is a nice example of a normal abdominal wall and one with a diastasis. So when we're assessing a DRA, typically we're looking at something called a curl-up task, or essentially a crunch. When we have a normal intact linea alba, what happens is when we engage and we do that curl-up task, it helps to keep the recti in line, and it makes the force in the correct direction. And as a result, we have nice tensing of that whole fascial system that wraps around our core. So that's what a normal curl-up task would look like. When someone has a stretched linea alba or a diastasis, when they go and do that curl-up task and there's that increase in pressure in their stomach, the fascial tension is no longer there in that linea alba, and as a result we get that typical doming look. So what happens is the pressure increases in the stomach, the viscera or your organs actually get pushed up into that loosened linea alba, and we get the little dome. So it's typically this that patients or our patients see, when they're sort of sitting up in bed, or they go to lift something heavy, and that's usually what brings them into us, because they don't like the look of that, and they know there's something wrong.